Good morning, everyone. Welcome to Global and Local Inequities, Reflections of the COVID-19 Pandemic. As you join, please share your name, what you teach, and one plan you have to make this summer incredible. We want to get to know you a little bit more. I am joined by representatives from the University of Chicago Centers for East Asian Studies, East European and Russian Eurasian Studies, and the Center for Middle Eastern Studies. I'm going to pass it off to Krishna to introduce the centers.
Awesome. Thank you so much, Joya. And welcome to everyone tuning in today. We really appreciate you taking the time to participate in this year's Virtual Summer Institute for Educators. I'm sure you are, exhausted with webinars, but we appreciate you taking a little more time to join us for this event. My name is Krishna, and I serve as the Outreach Coordinator at the Center for Middle Eastern Studies. This conference is brought to you by UChicago Educator Outreach, a partnership between the Center for East Asian Studies, represented today by Abby Newman, Connie Yip, and Myra Su, the Center for East European and Russian Eurasian Studies, represented today by Esther Peters and Matthew Weflin, and the Center for Middle Eastern Studies, represented today by yours truly. Though through generous support from the U.S. Department of Education Title VI National Resource Center grants, our three centers offer free programming on globally relevant topics for educators and the general public alike. You can find more information about each of our centers in the chat. Additionally, please visit the UChicago Educator Outreach website. The link is on the slide, educatoroutreach.uchicago.edu, in order to find classroom materials, event recordings, and other resources. Now I would like to turn it back to Joya to introduce the Pulitzer Center on Crisis Reporting.
Thank you, Krishna. So let's first go over our goals. So today we have a couple of goals for our entire event. We want all of you to connect with Pulitzer Center staff and journalists to discover reporting that you can share with your students. We also want you to be able to apply the experience of COVID-19 as a lens in evaluating global and local systems that perpetuate inequities. We'd like for you to connect with each other to evaluate and reflect on the challenges and opportunities presented by COVID-19. And finally, we want you to have the opportunity to explore ways to use journalism to teach research skills, text analysis skills, media literacy skills, and global competency skills. So I'd love to know a little bit more about you and some of the work you do. What age group do you primarily work with? That's really something that we're curious about as we continue to create spaces for you guys to work with each other and speak with each other. So are you an early childhood teacher, elementary school, middle school, high school, post-secondary school, or maybe you don't teach in a traditional format? We'd love for you to share with us in the chat. We'll have an opportunity to revisit this question as well. So if you're having cold feet right now, you can share a little bit more with us about who you are and what you do later in the presentation. Let's go ahead and go to the next slide, and please feel free to answer that question when you feel comfortable. So we're going to start today going over the Pulitzer Center and what we do, and we've also gone over some of our goals. And then we are going to welcome our incredible team from WBEZ to talk about their project on vaccine equity in Chicago. Then we will have an opportunity to, we will give teachers an opportunity to speak with each other about what they notice in the reporting and ways they might use it in their classroom. You might even notice ways that the conversation that our journalists have are reflecting issues you've already talked about in your classroom, and we want you to have that opportunity to talk about it in that think tank. Around 12 o'clock, we'll have a lunch break because food is important, and I will be eating at that time too. At 1 o'clock, we will have a workshop that's run by Pulitzer staff, myself and our associate director. We'll be talking about how to leverage journalism skills and COVID-19 reporting in the classroom with the Pulitzer Center. That'll be an opportunity for you not only to learn about some of the resources we have, but try some of them as students and learners. We'll have a break around 2:30, a 10-minute break for you to get coffee. Because we'll want you certainly ready and prepared to talk to other teachers about not only the reporting that you've been that we've reviewed today from the morning to the afternoon, but also some of the resources that you saw and maybe how you might bring them into your classrooms next year. And finally, we'll have a closing, we'll share a survey with you, and then remind you of some events that are coming up in the next couple of weeks. Thank you, Matthew. Let's go to the next slide. So the Pulitzer Center is a journalism organization dedicated to spreading awareness about underreported global issues by funding journalism that captures global underreported stories. An underreported story is a story that is not getting the attention that it deserves. We use our platform to amplify these stories by partnering with journalists, educators, and students and producing public events. We support journalists who publish their stories in a range of publications and outlets, and this infographic just shares just a handful of these platforms. On our next slide, you'll see that our projects cover a myriad of pressing issues. And you may notice an issue that you are interested in, or maybe that you've already explored in your classroom, and I'd be curious to hear what those issues are. So take a moment to review these issues and let me know what issue resonates with you and or what issue would you like to explore in your classroom next year. On our next slide, we're highlighting our education department's mission. We have a unique mission to cultivate a more curious, informed, empathetic, and engaged public by connecting students and teachers with underreported global news stories and the journalists who cover them. On our next slide, you'll see all of our programs and resources specifically for educators. Anyone has access to our collection of reporting from Pulitzer Center grantees, featuring stories published by media outlets from around the world, as well as reporting original to the Pulitzer Center website. These are available on our site without a paywall. We also have hundreds of lesson plans archived in our lesson plan library. These lesson plans are crafted by Pulitzer Center staff, partner educators, and all our standards align and encourage students to analyze reporting, make personal connections, and take action in their own communities. We offer students and teachers the opportunity to host our journalist grantees in their classrooms for free throughout the year. With our virtual journalist visits. Journalists have discussed a range of topics from their career, their reporting process, or the nuances of the story they are covering. One of the journalists who's with us today, Ms. Zamudio, has been in a couple of classrooms, so she can maybe speak to that later if you have questions. And finally, we offer workshops for students and teachers year-round. All of that information can be found on our website or in our weekly education newsletter. So let's go to the next slide. Today, we are excited to explore this incredible project tracking the vaccine ion equity in Chicago, Illinois. This project follows COVID-19 vaccine distribution across a historically segregated city and whether the groups that were disproportionately hit by the contagion end up receiving their share. This community-powered project combines explanatory utility-based content with accountability journalism to report on vaccines and vaccine distribution in the Chicago communities that have been most hurt by the pandemic, centering community voices throughout the reporting. I was really excited to share this screenshot with all of you because you can see how large this team at WBEZ was and what a collaboration has been. We are thrilled to introduce 3 of our panelists and reporters on this project. Let's go to the next slide. So today we're joined by 3 incredible journalists, Maria Inez Zamudio, Mariah Wolfell, and Kristen Schorsch. Maria covers immigration for WBEZ. She is an award-winning investigative reporter who is now part of the Race, Class, and Communities team. Prior to joining WBEZ, she worked for American Public Media's investigative team. She also worked as an investigative reporter for the Memphis Commercial Appeal and Chicago Reporter magazine. Mariah covers city government at WBEZ. Before joining the City Hall beat in 2021, Mariah worked as a general assignment reporter and producer at the station, where she covered the creation of and start to Illinois' multi-million-dollar recreational cannabis industry, as well as the city and state's healthcare system during the COVID-19 pandemic. Prior to WBEZ, Mariah worked as a reporter, producer, and all things considered host at WVIK, an NPR member station in Western Illinois. And finally, we're also joined by Kristen, who is a reporter on WBEZ's government and politics team, where she covers Cook County and public health. Previously, she covered healthcare, government crime, courts, higher education, and news of the weird, think coffin parties for Crain's Chicago Business, the Chicago Tribune, the Daily Southtown, and the Iowa City Press Citizen. Kristen has won more than a dozen local and national awards for her work. Her stories have sparked policy changes and spurred investigation. So I am going to pass it off to our incredible panelists. Attendees that are here, we encourage you to continue to engage with our journalists in the chat box. All of us are going to be in the chat box engaging with all of you. After their presentation, we'll have about 20 to 30 minutes for you to ask questions. So you can type your questions in the chat as they arise, or you can hold your questions until our Q&A section. I'm so excited to welcome our team.
Awesome. Thank you so much. So in the beginning of COVID in March of last year, which seems so long ago, we started, covering COVID. It really was a newsroom-wide project. Everybody pitched in. Schools were going remote. The CTA was drying up. Our politics and government team was covering the daily press conferences because Governor Pritzker was every single day updating us on the latest developments, which we carried live on the radio every day for a long time. And then, Mariah and I formed that initial team with our editors, Angela and Al, our higher education team, Kate McGee. I'm talking about, this mini healthcare team that we formed to focus on the healthcare aspects of COVID. So within the larger newsroom, Mariah and I were focusing every single day on what was happening that were impacting people's lives. And some of the big questions that we had initially was really digging into, how was the pandemic affecting people, but also hospitals, right? Some of the big questions that we sought to explain early on were, how prepared were hospitals to take on this deluge of sick patients? Did they have enough beds? Things like that, which we'll get into. But just in terms of when we got to the vaccines, which when this project started was, when vaccines arrived in December, and we'll elaborate on is some of the ways that we talked about and broke down vaccine coverage was through storytelling, through tools that we created at WBEZ to help the public also track vaccine distribution, through data. We relied heavily on data to tell our stories, and through community engagement. Next slide, please. So as I mentioned, Mariah and I were on this mini team, and some of those big questions, just to go back to that, were hospitals prepared? Did they have enough beds and ventilators to help patients breathe? Did they have enough PPE? We all heard these stories that nurses and doctors were running out of masks and gowns and gloves, and it was in crisis mode. And so we really sought to explain that early on. Also, because there was no repository with this information, hospitals can be very private about certain aspects of their business for competitive reasons. So to really get at some of these answers, we filed a lot of FOIA's Freedom of Information Act requests, and often got denied for those because this was deemed to be confidential information. But through lots of sourcing and Zoom interviews, Mariah and I were learning relatively quickly that hospitals were filling up, big and small. There was obviously a lot of panic among patients of where to go and what to do. There was still not a lot known about COVID at the time. There were staffing shortages because as nurses and doctors got sick, they needed to be replaced. We heard stories about when you think of the PPE supply, again, those masks and gowns and gloves. I mean, there were some doctors and nurses who would get one N95 mask, that was the respirator that would block out COVID the most, essentially. And they would carry it around in a brown paper bag all day because there just weren't enough to go around. And then there was a lot of anxiety. If you could go to the next slide, please. I wanted to play you a short clip. Mariah did this great story just talking about the toll that COVID was taking on doctors and nurses and others who were on the front lines here. If you can play that short clip, please. It seems like maybe is that not working for us? Okay, that's okay. And, besides focusing on how hospitals were doing, we were also focusing on the patients to illustrate the impact of the pandemic. If you can go to this slide, please. This man, this is Michael Bain. Mariah profiled him a few weeks into COVID. He's an attorney and a father in his 40s from Berwyn. He was hospitalized at Rush University Medical Center, which is a big teaching hospital in Chicago. And he documented what he described as this really brutal experience of having COVID. Could we see if this slide will play for us? Oh, can you go back to the other slide and see? Yeah, click on the audio. Oh, I apologize. These were all working for us earlier.
Sorry, why don't we go ahead, because these are really great clips. Why don't we go ahead and try exiting the screen share and re-sharing it, making sure that we are sharing the audio, Matthew?
Yeah, that'd be great.
Myra, can you tell me where that option is?
So at the bottom left-hand corner, before you click share screen, there is a little checkbox that says share computer sound.
Okay, got it.
Kristen, do you think we should visit that?
The point of all this is horrible, brutal, devastating, and it feels like I might be cashing my chips in. People have died. People will die. Might be someone you love. Please take this seriously. Protect the people you care about as best you can.
Thank you so much. Yeah, Matthew, do you mind going back to the previous slide so people can hear that audio as well?
They are going to start to experience burnout, fatigue, demoralization, feel depressed, wake up not wanting to go to work, and then feeling guilty about it, feeling kind of numb and distant from their work and disillusioned, like they can't help people.
Thank you. You can go forward to the Michael Bain slide. Okay, great. One of the things I just wanted to mention is, as you can tell, radio is a really intimate way to tell stories. So not only were we telling stories digitally for our website, but we really tried hard to convey the humanity, the toll this was all taking, from this personal perspective. And I think just being in radio, it really helped to give us a different way to tell stories throughout the pandemic. And just in terms of with Michael Bain, to explain a little more, so Mariah helped Michael record an essay for the air. As you can tell, she scored it with music and he voiced it. And I think this story really helped illustrate to people what it was like from a patient to catch COVID. We'd heard so much from providers on the front lines of what it was like to treat patients and how scared they were, but to actually hear from the patients, remember this time there were visitor restrictions. We'd heard from people who were literally being dropped off at the ER by their families and just, they had to go in alone. And so, another thing that we heard, something that really sticks with me is the number of people who moved out of their homes to protect their families during the pandemic. This wasn't just healthcare workers. This was, government officials. I cover Cook County government in addition to public health. And there was one commissioner who told me that his wife was working at Advocate Trinity Hospital. She was a respiratory therapist, I believe. And they had a young daughter who had asthma. They separated to protect their child. Another person I know, his twins, his infant daughters moved out of their home to go stay with grandparents to protect them because they were immunocompromised. So we really tried to illustrate on all fronts what this pandemic looked like. Next slide, please. So in terms of looking at Chicago and covering this pandemic, we all knew it was one of the most segregated cities in America. And people who have been in healthcare equity for years would tell you that what happened is no surprise. So fast forward to April of last year, Mariah and Elliot Ramos, who was then our data editor, broke this big story. We were all wondering who was dying most of COVID in Cook County, and it was Black Chicagoans. In Chicago specifically, 70% of deaths were from African Americans, yet they made up just 30% of the city's population. And this story really helped set the national conversation that people who were getting sick and dying most of COVID were Black Americans, and eventually Latinos also would become some of those who were most impacted by the virus. So again, if you ask doctors, nurses, advocates, community organizers who live in these communities that were most impacted, this was not surprising. And it's just now the public, I think, with the pandemic is catching up to these wide disparities. And, you know, when you think of healthcare in particular, it is unequal. The majority of hospitals that treat mostly Black and Latino patients, low income, these hospitals are on the south and west sides. They have less money, resources than wealthier hospitals around downtown and in the suburbs. And so when you think of this and how COVID would play out, all of this, the inequities were in the back of our minds as we reported out these stories, and it helped fuel some of our best reporting. And it also set the stage as we focused on equity when the vaccines arrived. If you can please share the next slide. Right, so one of the big stories that came out of this, Maria was on a team with some of our other colleagues, Natalie Moore and Esther Yoonjin Kang, and their editor Alden Laurie, and did this really important story in which they talked to the families of 50 people who had died of COVID to understand the systemic issues behind the pandemic's impact. They focused on 4 zip codes with the highest and lowest number of COVID cases and deaths to really illustrate these vast inequities in Chicago. And they detail these building blocks that fueled these high death rates. So people whose jobs were essential couldn't work from home, people who didn't trust their local hospitals. And in one case, I remember what was really vivid from their story to me was a person who took an Uber to a suburban hospital because they had so mistrust of their local community hospital. And many of these people who had died lived in areas where their hospitals, again, didn't have as much money or resources as hospitals in other parts of the city. And they didn't have enough access to COVID testing as well. Next slide, please. So this is another big story that came out of our coverage, is that small hospitals, you know, in these poor communities that have, you know, 9 to 12 ICU beds, for example, when they were slammed with these most vulnerable patients, low income Black and Latino patients who were disproportionately getting and dying most of COVID, they had little help when they were full. If you can listen to a clip of this, that'd be great if you can play that.
We didn't hit that point where there was really a free sharing of information around what the beds and capacities were throughout the city, so that we could be sure that if a patient was sitting at Jackson Park Hospital, that they had equal opportunity to get to whatever hospital, you know, would be able to take care of them.
So that's Dr. Paul Casey. He's the chief medical officer at Rush University Medical Center, which is a big teaching hospital on the Near West Side. So what he's referring to is Rush took on a lot of patients. It was one of the only big hospitals to take on a lot of patients from these smaller community hospitals when those small hospitals got really overwhelmed and had nowhere to send their patients. The problem was, you know, that there was this daily dashboard that hospitals were supposed to report into that said, hey, we have beds free. Let's work together to make sure that no one fell through the cracks if they were really sick or needed a higher level of care, like a ventilator or an ECMO machine to help them survive better from COVID. Rush was one of the only places to take some of these patients. And what the point that Dr. Casey was making is that even though there were these metrics that hospitals were apparently sharing, they weren't always truthful and transparent about how many beds they actually had. And so one of the ways that I went about trying to get at this story was that I created my own database and called all the hospitals in the city and surrounding suburbs and asked them, how many patients did you take? How many transfers? What was the race of these patients? just to truly understand the scope of this problem, because nobody tracked this. And remember the field hospital, McCormick Place, that was set up to take less sick COVID patients, that ended up not really helping because they only took 38 patients in the entire pandemic. Later, a federal database would show that some of these biggest hospitals in Chicago had beds to spare when these small hospitals were full. That's just another example of reporting that we focused on with equity. If you can go to the next slide, please. And Mariah is going to take over this section.
Hi, everyone. Thanks for being with us today. I'm excited to talk a little bit more about some of the different ways we tried to provide resources to Chicago residents during this very uncertain time. Kristen kind of went over some of the issues that we prioritized, racial gaps in who was contracting COVID. Later, we'll talk a little bit about gaps in vaccine distribution. In addition to covering those issues, we also talked about hospital capacity and how healthcare workers were faring during the pandemic. We wanted to provide resources and tools to listeners as well. It felt strange to not do so, to be covering all of the things that were wrong and scary and uncertain without providing tools to help people during this time. So we created this landing page, COVID-19 in Chicago and Illinois, where you could find resources, either vaccine trackers or resources linking out to the state and city websites, and then vaccination data trackers. So if you can go to the next slide, I can talk a little bit more about that. These are two of the main tools that we created. On the left, you see questions: how old are you? Where do you live? We created that very early on to before finding a vaccine was as simple for some people as it is today. We created an eligibility tool. Remember when we were going through all of those phases, 1A, 1B, then there was 1B plus, then there was 1C. It was very confusing. And our colleague, Becky Vivi, who was also on this team, helped to break that down. It was an interactive tool where you could click, what category applied to you, and would tell you where and when you could get vaccinated. And how long it would be until you could get vaccinated if you weren't yet eligible. It also provided definitions. So if you see, do you reside in a Chicago community hit hard by the pandemic, you can click definitions for those what qualifies you as someone who's been hit hard by the pandemic, which was something that I think a lot of the state and city tools did not include, or just quick news clips or news stories that you would read. There would often be a lot of unanswered questions, what's an underlying health condition and those sorts of things. And so we tried to make that as clear as possible. On the right is our tracking vaccination and COVID-19 cases tool. Obviously, this is just a screenshot, but it's an interactive map. You can click on different zip codes in the city of Chicago, and that would tell you case numbers, as well as who's partially vaccinated and who's fully vaccinated. As Kristen said, it was no surprise to people who had been covering this and who'd been working in healthcare, the disparities in COVID-19 cases. I think it was also not a surprise that the fewer vaccinations within a community, the more COVID-19 cases there would be, and that would concentrate in underserved areas of the city, including the south and west sides. As you can see, the darker areas of that map are highly vaccinated communities versus lighter areas of the map are lower vaccinations. And I would bet that if you would click on those areas of the map, they'd have higher case rates. So those were two very interactive tools that we were proud to continuously update every day. The vaccination rates tool is still being updated. Obviously, the eligibility tool is no longer useful for people, but if we could go to the next slide. Another tool that we created out of this pandemic, completely new, a new format for us on the air, was a COVID-19 vaccine drop-in, where we solicited questions from listeners, from people online, and from people at our community events, which Maria will talk about a little bit later. For this, when the vaccine started to roll out, there were just all of these questions. We had our own questions from, when can I see my grandkids after being vaccinated, to what happens if my second appointment gets, canceled after I get my first dose, to will the vaccine cause infertility? There were all of these questions circulating. I'm sure you all had so many of your own as well. It was an uncertain time. I don't need to say that again, but we wanted to create an on-air presence, a regular presence where we were answering the questions of our listeners. We thought that was very important because we had been covering this for a year. So there were things that maybe we knew that we took for granted knowing. And we really wanted to be inspired and motivated and led by listeners to make sure that we were, actually being useful to the community and answering questions that they still had. So we can play one of these clips. This is a vaccine drop-in that we aired Monday, Wednesday, and Friday, 3 times every week. Every day it was a different question. And we did that for 4 months. So if you could play this first one.
I'm WBEZ reporter Becky Vivi. WBEZ is virus vaccines, like this one from Lisa Andujar in Hermosa.
I have 4 children, 17, 14, and a set of twin boys that are 9. My oldest twin, he is a severe asthmatic. I want to know, why isn't the vaccine okay for children 18 and younger?
COVID-19 vaccines haven't been authorized yet for children because they haven't been fully tested in children. Vaccine makers have to run separate trials because young people's bodies are still developing and may react differently. Dr. Archana Chatterjee sits on the FDA panel that authorizes vaccines. She points out that one of the 2 vaccines available can be given to some teens.
The Pfizer-BioNTech vaccine is actually authorized for use in 16-year-olds and up.
So Lisa's 17-year-old could get one, but what about kids younger than that? Those trials are still underway.
The trials include children down to 12 years of age, at least for the Pfizer-BioNTech vaccine.
That means babies, toddlers, and Lisa's 9-year-old with asthma could be waiting months or even another year for a COVID-19 vaccine that's safe for them. We're able to answer your questions about COVID-19 vaccines thanks to support from the Pulitzer Center. Find all our coverage at wbez.org/vaccine-FAQ.
So that was reporter Becky Vivi. That's just a sample of, dozens of questions that we answered over the air, and also followed up with question askers to send them answers to the ones that we didn't get to on air as well. We got over 300 questions and tried to answer as many as we could to be a very clear utility to listeners. You can still find we've since stopped doing the COVID report. Obviously that report was from April when kids weren't eligible yet, but you can still find that on Spotify. So if you could go to the next slide, please. So we're going to actually have Kristen come back and talk a little bit about the work we did that was inspired and, supported by data that we fought hard throughout the pandemic to get.
Yeah, thanks, Mariah. Right, so the city, during the entire pandemic, they talked a lot about Mayor Lightfoot and Dr. Allison Arwady, the public health commissioner for Chicago, talked a lot about equity and really having, making sure that the most vulnerable people were getting access to testing, were getting, the right health care, all these things, right? So when it came time to get a vaccine, we really wanted to understand the full scope and be able to track it. Were Black and Latino Chicagoans who were getting sick and dying most of COVID, did they have as much access to the vaccine as the white population? And where was this going throughout the city? So one of the things that we did was our colleague Becky Vivi, who you heard on the drop-in, the city did post a lot of data online. So you can go online right now and you can look at all the city's data for, the age of people getting a vaccine. The zip codes were the vaccination rates by zip code, and by gender, I believe, and by race. So Becky would take that and she created a Google Doc that she shared with us, and every single day, look at the numbers, find the trends. That's also how we had our first big story on this was to understand, since vaccines rolled out in December, how was it going month by month? In February, the city started a program called Protect Chicago Plus, which is their main way to boost vaccination rates in some of the hardest hit communities by COVID. So there were 15 neighborhoods that got saturated with vaccine. The first weekend where they went into Belmont Cragen, which was the first neighborhood that they were saturating with vaccine, there were more than 2,000 people who got shots that weekend. And so we paid really close attention to that program since it was the city's main way to boost vaccination rates among a lot of the Black and Latino communities. These two stories that you're seeing here, vaccines in Illinois are still largely going to white residents, and how one Chicago zip code got 500 times more vaccine doses than another. These are examples of our big focus on data, to really make sure that this was an equitable rollout. The city, the Protect Chicago Plus program did make a dent. They did help boost vaccination rates in Black and Latino communities, but still time and time again, you would see that that wasn't enough, that white residents were still outpacing in terms of vaccination rates. A lot of people talk about, well, there's hesitancy in Black and brown communities, right? There's medical mistrust. There, you think of the Tuskegee experiments. And yes, that is true, right? There is a lot of hesitancy, but there's also a lot of access issues. I filed a FOIA that took about 6 weeks to get back that led to the story on where the doses are going. So we finally, for the first time, were able to see, okay, the city controls all the vaccine for the most part. Where were they shipping it? We saw by zip code where it was going. And you could see pockets of the city not getting any vaccine. Now, some of the reason for that is because on the south and west sides, there are healthcare deserts. There are areas where there are not a lot of providers. Or there are providers that are small. They don't have access to the refrigeration you needed to store a vaccine. They didn't have the staff. They didn't have the space. You need people to wait 15 to 30 minutes after getting a shot. There were lots of providers who told us we can't handle that. But still, this was the first time that we all saw where the doses were actually going to help hold the city accountable to say, are you meeting those equity goals you set? So those were some of the examples of how we use data to really understand the scope of where the vaccine was going, who was falling through the cracks. It also helped generate some other more community-focused features. One of the features that I worked on was in Chinatown. Chinatown was not considered a high-risk area. When you looked at the data the city was using to essentially steer the vaccine towards the most vulnerable communities in terms of people who are more susceptible to getting and dying of COVID, Chinatown wasn't on that list. They were considered low risk. But then if you actually go and talk to people in Chinatown, you go to the vaccine clinics, you talk to community leaders, the business owners that had been largely, shut down for a year, they would say, but wait, we have language barriers. For a lot of people who came from China, for example, this is their whole world. They're not going to go to the United Center to get a vaccine. There were low literacy rates. So there was a lot more to the data. Mariah and Maria both did really great stories out of the data as well. Maria also told a really great personal story about her family and how the lack of translation in a lot of communities was another barrier to access to the vaccines. And then a story that had a lot of impact as well was Mariah got a tip about a clinic that was charging for vaccines. They're supposed to be free. After she wrote that story, they paid everybody back. So these were just examples of how we were using data to hold people accountable, but also led to other more community-focused features to tell more people stories as well. Next slide, please. I just went over a lot of these findings, but I'm happy to keep going over them, sorry. But right, just in terms of white Chicagoans were still receiving a disproportionate number of vaccines from the beginning. It was really hard to make a dent in these equity figures. And then the disparities, just in terms of, this is something that we focused on the entire, time of our project, which we have been winding down. If you can go to the next slide, please. And then I'm gonna leave this to Maria to pick up on.
Thank you. Well, thank you all for joining this conversation. So I wanted to take a step back and kind of explain why, when I was thinking about community engagement, I was really sort of thinking about centering the most vulnerable communities. So the entirety of 2020, I spent reporting from really poor communities. I spent a lot of time in Little Village. I was part of that project that looked at disparities and how they played out during the COVID-19 pandemic. And so I focused on the 60623 zip code, which includes the Little Village community, which is a mostly Mexican immigrant community, and the North Lawndale community, which is a mostly Black community. And there's 2 hospitals there. They're both community hospitals, St. Anthony and Mount Santa. I can't even say it. I'm not going to try. So one of the things that was really sort of present for me as I was continuing to do these stories, I was doing door knocking, I was leaving letters, I was trying to reach folks who had lost someone to COVID-19. And the story that kind of came out of those interviews is one of a community that was probably in the worst space coming into the pandemic. It was a community that had felt very targeted by the Trump administration and his policies around immigration. It was a community that was very aware of the fact that if they got caught by law enforcement, they would essentially be deported or deportable. And so there was a lot of mistrust among organizations, including hospitals. Not to mention that this community was also doing a lot of the essential jobs, grocery stores, restaurants, a lot of those jobs that you can't really do from home. So they were being exposed at higher rates. They were also living in multi-generational households. So when you have multiple people going out for work and then coming back, there was a higher risk of them getting COVID. And one of the things that really kind of stuck with me is interviewing families of people who had someone die of COVID-19 in their homes because they were too afraid to go to the hospital. And a lot of what I was seeing was a lack of information, lack of resources to support this community, lack of access to good information in their language. And so when we were thinking about the vaccine coverage rollout, we knew that we wanted to have an emphasis on equity issues. But what I was really trying to do is not focus so much on the storytelling. We do that well. What I really wanted to do is sort of think about other ways that we can bring the information to the most vulnerable communities, the communities that were disproportionately impacted by the pandemic. So within that context, we created virtual events. It was a Q&A virtual event targeting the Latino community and the Black community. We started with the Latino community because that's the community I know. And so we were trying out different things, including language access. Next slide, please. So we created WBEZ in Espanol. A third of the households in Chicago speak a language other than English in their home. So Spanish is the most common one. We decided to go with Spanish because it's also the language I know. So when the pandemic hit, there was also a lot of different things going on in the community in Chicago. The last daily newspaper in Spanish that had been operating for many years closed down under the Tribune Company a few years back. So there was a lot less access to reliable news in Spanish. So I created an independent podcast back in 2020. And it was a really good opportunity for me to learn because I was creating content and I was getting a lot of feedback from first generation English speaking folks who actually took the information and gave it to their parents. And so when I brought the idea to WBEZ to translate our vaccine coverage, everybody was really welcoming to that idea. And we all started working towards figuring out how to make that happen. We hired translators on a contract basis. We hired editors. We hired one editor who helped us do some copy editing, and then also develop a style guide that we would be using for the rest of the time. Now, we had to build everything from scratch, right? WBEZ did not have an infrastructure to deliver news in any other language other than English. So there was a lot of things that we wanted to do. We wanted to really be cognizant of the fact that we just didn't have the resources to continue doing a lot of this translation day to day, because we were producing a lot of work in English. So we were really, we looked at the coverage and we figured out which stories would live longer and provide more context for this population. So we translated the frequently asked questions tab. We translated the tool that kind of let people know which group you belong to, so that you could get access to the vaccine. And that was really big because, you know, that tool was super important for our English listeners. And you could, you know, put your age and, you know, a lot of other information so that you know exactly when you would be eligible to look for the vaccine. And we wanted to do that the same for Spanish speakers. So we translated a lot of that stuff. However, we didn't really, again, we didn't have an infrastructure. So we didn't really have a way to deliver this information to a new audience. If you can please go to the next slide. So this is where we kind of relied on these events. We created a bilingual event to introduce WBEZ in Espanol to Spanish speakers. And we did that by really partnering with a large group of different community organizations in the city of Chicago, including the Mexican Consulate. And that was sort of like a really interesting conversation about the joint effort. And there was a lot of delicate negotiations around what would be ethical for us to do, what are sort of the challenges around creating those partnerships. So we learned a lot. A lot of these organizations ended up hosting the event. They were live streaming this event through their own Facebook accounts. And so that created a really great opportunity for us to introduce all of these groups to WBEZ. A lot of these groups didn't even know that this news organization cared about them or that it even exists. So we had a really great turnout. And if you go to the next slide, this is sort of like the overall numbers of people that we reached through each one of the organizations that we partnered with. So you'll see how many people are watching from the Illinois Coalition for Immigrant and Refugee Rights Facebook page. You could see who was watching from Belmont Cragen United, from Esperanza Healthcare Centers. So we did a really good job in terms of like really bringing in this community. But what we also did, I was producing this event, is that we had a lot of different reporters tuning in and really paying attention to the comments that were being posted on these websites. So we had an intern who spoke Spanish, we had another reporter who spoke Spanish, really kind of go in and take a lot of those questions, and then they would send them to me, and then I would figure out the best one that we didn't already have in the program, and I would give it to Araceli. The other wonderful thing that we did is that, you know, we got Illinois top doctor, right? Dr. Enrique as our, you know, one of our panelists. And so that was a really big get for us. That meant we're really committed to this, and we're really trying to make an effort to reach out to this community. If you can go to the next slide, please. And we ended up getting a lot of great feedback. This is one of many really great comments that we got. I think people started really noticing these efforts, and they really appreciated those efforts. So what we did was we took the success from that bilingual event and we sort of applied the basics of it to target the African American community in Chicago. And so our colleague Natalie Moore hosted that event, and we had a great lineup. And we sort of followed the same model. If you can go to this next slide, I just want to make sure that you all see this. Wonderful, thank you. And they sort of followed the same model. We worked with a lot of different organizations, and they also co-hosted the event, and they streamed the event live on their social media accounts. If we can go to the next slide, please. So you can kind of see the breakdown of this, like who was tuning in and for how long. And that's really important for us because it's sort of like a guide for us to understand what worked and what didn't work. And it really just showed us that if we make an effort to kind of reach out to these communities, there is a desire for engagement. We just have to be very intentional about that engagement. I don't want to go in too much into detail about that, but that's all I have. I think that we have another slide kind of going into takeaways. And I wanted to just really have this with my colleagues, because the wonderful thing about covering, the positive thing about covering COVID-19, both during when it was happening and during the vaccine distribution, is that it provided opportunities for us to do things differently. It provided opportunities for us to say, a lot of this information that we're reporting, it doesn't only have to go on air. It doesn't only have to go on our website. It can be a tool that audience can engage with. Audience can send us questions. The audience can really engage with us in a live format. So it really created a lot of different opportunities for us to engage with those communities. So I think this takeaway is from Kristen, maybe?
Yeah, right. So one of the kind of the finale stories of our vaccine coverage was this story that Becky and I did, what Chicago's fight against the pandemic could teach us about fixing healthcare. So we all, right, this past year, we've all talked about these inequities that have been here for decades, for generations. And so people are vaccinated, not everybody, right? But what's next? How do we make sure that any gains that we made in terms of equity actually continue and get better? And so this story focused on talking to a lot of people who were involved in treating patients during COVID, the boots on the ground community organizers who raised their hands and said, we need help in this community specifically, we're not getting enough of X, Y, and Z. And so this story really focused on what is the future of health equity? And there are a lot of conversations happening. And one of the things that we learned was, you have these big affluent hospital systems in Chicago. You have these smaller ones that mostly treat low income people of color. You have the FQHC clinics that are also anchors and staples in low income communities. And all of them talked about these lessons learned. And one of the things that came out of this was that the community organizers were really big linchpins for the city, for the hospitals, for the clinics when it came to COVID, whether it was making sure there was enough accessible COVID testing, to getting masks and even food and housing for people during the pandemic. And so now all these conversations are happening. There's this giant table, so to speak, that's been set. And the city is actually giving out $10 million a year in as part of an RFP process, as part of a proposal to fix health equity going forward. So this is something I think that was really positive that came out of the pandemic, is that it started these very uncomfortable conversations among a lot of people who were involved in their own corners. And they came together and they said, we can't let this perpetuate. How do we fix this going forward? So this is kind of one of our finale stories. And I would just say, personally during the pandemic, I focused on a lot of accountability reporting and wanting to know how were you going to help the clinics and the hospitals, the patients that we knew would be most vulnerable from the start. I've covered healthcare for 10 years, so I knew that going into this, which hospitals had nothing, so to speak, compared to big, rich hospitals that had a lot more. We filed a lot of FOIAs. We got a lot of denials because of privacy concerns, because of the way state law is written. And that was very frustrating. But I hope that in terms of when you think about public information, just the persistence of myself and other reporters who were covering COVID really pushed the needle and forced more transparency in a way. We finally got information on where outbreaks were happening. This wasn't until 6 months into the pandemic. We didn't know where people were getting sick the most. I mean, how can the public, why didn't we know that? We should have known that, to me, from the start. We finally started to get information on the types of jobs people had that, so we knew where they maybe were at most risk of getting and spreading COVID. A lot of the reasons I learned about why we didn't have some of this information from the beginning is that the government did not know a lot of this information, but they didn't really convey that. They would just deny FOIAs, say there were privacy concerns. So anyways, I think that there's a lot more transparency that came out of this. And I think there was a lot more data so the public could be informed and really help make their own decisions about the way that they were protecting themselves and their communities.
I think that my colleague summed it up very well. To build on Maria's point of collaboration with communities, I think never have I ever collaborated more with sources than I did during the COVID-19 pandemic. I mean, you heard the story of the man recording in his hospital bed. I edited his essay with him. I taught him how to record on a cell phone. I was on the phone with him, having him record. That was his story, his words, and it was non-narrated. My voice wasn't in it at all. I typically, a feature story you hear on WBEZ, it's a reporter introducing tape of people. We did so many non-narrated stories. I taught so many nurses how to record themselves in their hospitals. We did a series where we had nurses and doctors, record their day for us with the angle of asking them how they get through the day and how they maintain their mental health. That was part of the, a lot of the series that we did on mental health of healthcare workers. But those are things that I would like to continue throughout, my reporting going forward, is really taking the lead from community members about what they want to hear. I mean, that question and answer segment that we played as well, it can get so easy as a journalist. You're taking in information all day. It can get so easy to fall into this trap of thinking the answers and what the community needs to hear. And sure, we have a certain authority because we're doing it every day, but it was very refreshing to take cues from people who needed resources. And that's a legacy I want to continue. That's one of the legacies that I want the pandemic to have on our journalism. And WBEZ is very well positioned to do it, I think, because of us being a public service organization. And so that's something that I'm excited about. I also loved that what Maria said about our journalism not just living on the air or in writing. It can live in community spaces. It can live in just interactions with the community through events and just engagement. So unless my colleagues, Maria or Kristen, have anything else.
If you can, I think there's one more slide in there. Yeah,
Okay.
so, one of the challenges that, we sort of encountered as we were building capacity for WBEZ in Espanol and also the bilingual event that was completely done virtually is, access to quality translators. We had a lot of really great comments from the folks who attended, but we also had this comment, and we did have challenges in the beginning because we had a call-in number for folks to tune in Spanish. Initially, my idea was to have the event completely in Spanish and then have English subtitles. And, you know, for a lot of reasons that did not happen. And I think that it just shows you and all of us in media that we can come to community and provide this information in a very direct way. I think that sometimes we get so caught up in the traditional ways of doing journalism, right? The traditional stories for audio, the traditional online stories, the traditional, you know, database reporting, which I absolutely love, but I think it's really important to really center the communities that we're covering. I'm working on an investigation right now, and I have come to the realization that it is not just enough to focus on the end product, the investigation at the end, that it is really important to engage with the communities that we're covering, because sometimes we don't do that. And sometimes we're writing about some communities for other people. And so while I'm sort of working on this investigation, I'm really being intentional about how do I make sure that the information that I'm discovering during this investigation is actually going to the people affected by this. And so one of the things that I learned during this community engagement things, organizing events, which is something that I had not done before. I'm a reporter first and foremost, but I got to step into this other role of creating space and providing these opportunities for the people that I've been writing about for years, right? And this is something that I think about all the time because my mom doesn't speak English. My mom has never read any of my investigations, right? So it's really important for me to really think through, okay, what does it mean for me to do this work? And not just to do the work for a specific audience, that I'm actually including the people that I'm writing about. So those are the things that I took away from this experience. And I'm really fortunate to be in a space and a company that values that. And it really shows in the way that we deliver the work. So I'm really grateful for that.
Yeah, I just want to piggyback on that. I think the community engagement aspect of what we do is so important that we shouldn't just be approaching communities when we're doing stories, but we should be talking to them a lot more about what we should know that we don't know. And I think that I was blown away by the number of questions we got for the drop-ins that we played for you. We also did this last fall with our election coverage where we put out to communities, specifically targeting communities hardest hit by COVID with you know, infections, deaths, and unemployment, people who lost their jobs. And we got, I think it was more than 1,000 responses of, essentially the question was, what do you want your public officials talking about? And people the community members want to talk about what's happening in their neighborhoods. And if we only do stories that from our perspective are important without being more informed about what is more important, maybe what's necessary, I think that we lose some of the power in our journalism. So I would love if you all have ideas about how we can be even more engaged. We do have a community engagement team at BEZ, and we are very committed to, you know, even ramping that up more. I mean, yes, like Maria and I are not on the community engagement team, but we are constantly talking with people in communities for what we do. But it'd be great to get even more information about how we could connect with people, you know, beyond just the stories that we're working on. I'd love to do like an office hours sort of thing where we just go into communities a lot more and people just come and talk to us about what's on their mind. So I'm open to suggestions you all have too.
I think those were all the slides we have. If you can go to the next slide, just so that people have our contact information. All of us are very accessible, so feel free to email questions or comments. I certainly welcome them. I know my colleagues as well. But with that, we'd love to turn it over for questions.
Thanks so much to this incredible team for your presentation. In a moment, I'm going to hand it to Esther Peters, who is the Associate Director for Center for East European and Russian Eurasian Studies to facilitate the Q&A, but I did drop Kristen's question in the chat. So as we're answering your questions, think about this question that she's asked you. How can WBEZ, how can reporters keep the community more engaged? And how can we connect with more communities? If you have an idea, throw it out in the chat. We'll save the chat and make sure that not only our journalists get it, but you all get it as well. And of course, please continue to share your questions in the chat. So Esther, I'm going to pass it to you.
Thank you, Joya, and thank you to Mariah, and Kristen. That was a fascinating presentation, and I know I have questions, but I will hold those in the unlikely event that we have time and have gone through all the questions we already have. We do have the ability, if you would like to actually voice, speak your question directly and not just have me read it, we do have that ability. I think you should be able to raise your hand and I'll be able to see it or in some way indicate with one of the reactions, and I'll try and keep an eye on that, as will my colleagues. If you have a question that you would like to ask directly, I'm going to go ahead and start with some of the ones that were in the chat. So the first one is from Mahad Jarad. I hope I pronounced your name correctly. And she wanted to know, what do you think of the claim that among Black people, there are a lot of people who just don't want the vaccine? Do you believe that is true, or is it because of a lot of access and inequity? And I think this was addressed a bit, but I wanted to give you the opportunity to maybe expand on this question between hesitancy and as real versus maybe an excuse for these disparity in access and other inequity issues. I don't know who wants to go for that for any of you, so I'll leave you to decide who wants to start with that.
I will just say something quick. I think that we can all talk on this, but I think that you can't untangle hesitancy and inequity. I think that if someone is hesitant to get the vaccine, the reasons behind that are rooted in longstanding inequities in Chicago, either being mistreated by the healthcare industry, by doctors, by not having access to healthcare, or mistrusting, government officials for valid reasons. So I think that to say hesitancy is, a myth, and that the vaccine is just not accessible is not the right approach. I think that it's better to look at the ways in which hesitancy and healthcare inequities are intertwined. I do think, though, that, it was very important early on to not get caught up in saying, well, African-American or Latino communities just don't want to take the vaccine because there were and are serious equity issues and access issues to the vaccine. And so I think both are at play. That's my take. I don't know. I saw Maria unmute herself. If you want to add to that, Maria.
Yeah, I think multiple things can be true at the same time. We kind of went into vaccine distribution with this idea that Black Americans had a higher hesitancy rate. But when you look out the rollout, I think that it is very obviously clear that it had a lot to do with access. Even when we were talking about, opening up the mass vaccination site at the United Center, and the ways in which you had to book the appointment, right? That was done online. Connection rates in the south and west side of Chicago are fairly low. So there is a big question about access. And I think that there was a little bit too much coverage around hesitancy among the Black community, when we can very clearly see the vaccination rates in white, conservative, rural areas, right? So I think the multiple things can be true at the same time, which is why for me, it was really important to really focus on the policy, on the data, right? Because I think that at times when newsrooms don't understand a community well, there seems to be, you know, this one story that gets played out over and over and over again. And so we at WBEZ tried to rely heavily on data. We did do stories about hesitancy. We did include those questions in the live Q&A events that we had. And there was a lot of great conversation about why that hesitancy existed, right? It wasn't only about the Tuskegee experiment. It wasn't about that. It was actually about the fact that a lot of Black people in Chicago don't have access to a good doctor, to a doctor that actually values what they have to say. That treatment really plays out, right? So when you have those direct experiences with doctors that do not hear you when you're saying this hurts, that do not understand what you're saying, then obviously there's a disconnect there. And there's also, as Kristen has reported very heavily, the fact that there is existing issues with the healthcare system, right? There's not a lot of pharmacies. Some of the community hospitals don't have a lot of access, right? And so I think multiple things can be true at the same time. And that's why it's important for us to really kind of dig into the numbers and the policy, because I think that's really where the nitty-gritty is.
Yeah, I think Maria and Mariah summed up everything I would say as well. But yeah, I think that we should all be careful not to paint like an entire population with a broad brush. There are a lot of reasons why someone might be hesitant to get the vaccine. But yes, I also would point out access issues. Access is a major issue. It's a major problem. When you look at the number of specialists, the number of pharmacies, the number of people who have a primary care physician, like Maria said, on the South and West sides, it is way lower than the North side. You think about not only like the accessibility to the internet, right? You think about people who have low wage jobs, people who can't leave work perhaps in the beginning. I know there's a lot more conversation now about getting time off to get a vaccine. But you look at where those vaccine doses went, and you look at the resources of the providers, even if they wanted vaccine in their communities that just couldn't handle it and were upfront about it. Also, something that I thought was frustrating early on is, you know, the first thing I thought about when I said, oh, the vaccines are coming. Well, the primary care physician should be getting them, right? Because if you have a PCP, that is your first point of care. You get sick, you call your PCP. I mean, if you don't have one, you go to urgent care. But for the most part, your primary care doc and you have trust. You have a relationship. And PCPs barely got any vaccine because there was such tight supply. I realize that. But they were not on the list to get vaccine. And I talked to many family physicians who were very frustrated by that, who were like, I know I can convince my patients to get a vaccine because I'm a Black physician, for example. I talked to a lot of physicians about that, and they thought that they could really build trust because they already had it, but yet they had no doses. So there's a lot, obviously it's a very complicated picture, but I think that we tried really hard to explain all this and actually went out to the communities and talked to the people about these various issues.
Great, thank you. There's two issues that I think we have some questions that kind of follow up on this question about kind of access disparity as well as community. And so kind of keeping with the community theme for the moment, Yiwu asks, community is a key word in this conversation, wondering who are community leaders in these underprivileged communities? Are they church leaders, community center organizations, or school teachers?
I mean, they're all of them, right? There's so many community organizers, whether they are teachers or church leaders. Church leaders were a big part of, you know, when the vaccines came out. There were a lot of pastors who came out and said, hey, we're getting our vaccine. Like, please trust that this works, trust the science. They were part of some of the hospital marketing campaigns. I think it was Rush who had several faith leaders come and get vaccines and had a press conference about it to show people that this was safe. We've talked to a number of community organizers, whether they're with the FQHCs, who also partnered with places like Northwest Community Housing Center in Belmont-Cragen, SWAP on the Southwest side. There are lots of organizations, Austin Coming Together, that were boots on the ground, and the city, they knew that too, right? I mean, you saw the city partnering with a lot of these organizations and the providers partnering with them as part of the city's Protect Chicago Plus initiative. So, you would have like Rush partnering with PCC Wellness and Austin Coming Together to give vaccines in Austin. So we saw a lot of these relationships building. And so I think a lot of these folks were, you can say, our community organizers, or I'm sorry, part of the community.
Yeah, I would just add a few things. I think what we saw during the pandemic was this organic thing that happens in vulnerable communities, which is that somebody loses a job, we all pitch in money, right? Somebody gets sick, we all try to be there and help out. That happens in Latino communities very often, in Black communities very often, in Asian communities often. And so taking on that model, I did a story about promotoras de salud, or community health workers, and it just takes that model of peer-to-peer, right? Where someone gets training, someone from within the community gets the training to have all the answers around COVID-19. And they would go out to community spaces like laundromats or parks or other community spaces, and they just had conversations. And so I think that that's also a really unique way of communicating information to these vulnerable communities. I did see a lot of young people step up, organizing online and really creating space for each other, creating, fundraising opportunities. And I think that a lot of that stuff came up organically. Yes, there's a lot of nonprofits doing that work as well, but I found it really, really interesting sort of seeing people step up into those roles to care for each other. So, that's the unique way that this pandemic played out, I think, with those community leaders. And I would describe them a little bit different as well.
I forgot to unmute myself, sorry. Just to add to this conversation, we just got a really great question related, I think, directly to this, and I want to jump there next from Charlie. As a CPS science teacher, I grapple with the health inequities and the distrust in Western medicine within immigrant communities. I wonder how the city can support this issue and how we can approach the leading voices within the community.
Yeah, that's a big problem. So one of the things that I was hearing from sources was how the ways in which government works also hindered the ability to translate reliable information, right? Because they had to hire, translators, they had to draft the contracts. And when information is flowing and is being updated daily at times or weekly, it can be a real challenge. And so that was something that definitely created a void. So communities, immigrant communities from all over the city, right? Asian communities, Latino communities, they all have different languages. And so I think that there was that void really created a lot of uncertainty because folks are really reliant on social media. And we know that social media, is great at disseminating not great information. So I think that really played out not only during the pandemic as folks were trying to figure out the ways in which they could keep each other safe and their families safe, but also during vaccination, right? My own brother did not want to get vaccinated. He just did not think that it was necessary. He had already gotten COVID. And so we just had a series of conversations, right? And this is where I think it's really important for us to be patient and to just engage with people, right? You meet people where they're at. You listen to them, you evaluate what's going on, and then you provide accurate information with the knowledge and understanding that it may not stick the first time. My brother just got a second dose not that long ago. So it works. However, it takes a lot of time, it takes a lot of effort. So I do think that this two-way model of interacting with someone from your own community can be really helpful. And I do wonder whether the state and the city will put some money into those efforts, because a lot of the promotoras de salud that I met were undocumented, had been doing this work with not a lot of pay, were really putting themselves at risk, right? By going out to laundromats, which is places that a lot of immigrants sort of congregate around, and really having these conversations to provide that information. I think the city needs to really, the city and the state, they really need to try out different programs and different things, because the things that have worked for English speakers and white communities is not going to be the same thing that is going to work in other communities.
Yeah, I would just say that I saw a lot of, like in Chinatown, for example, when there was a lot of misinformation or lack of information, I saw a lot of people looking to their community leaders. So the Poi Talk Center, for example, is a huge community staple in the heart of Chinatown. And they really led the way in setting up their own vaccination clinics. There were really, they knew that people were not going to be going to the United Center. So they surveyed residents. They created, I think it was a Google form in Chinese as a way to essentially weed out people who they knew maybe speak English, could get a ride to another vaccine clinic. And they created a waiting list. They had a really long waiting list. And there are a lot of social service agencies in Chinatown that work with the Chinese speaking community. And they essentially became the focal point and the leaders. Those folks were the ones who were going to the city and saying, we need more vaccine. And then going out and partnering with other providers to get those shots. So, I think that was an example of filling that void of, well, if we're going to bring the vaccine to our community, no matter what, and it worked. They were able to vaccinate a lot of people who they think likely would not have gotten a shot otherwise if they didn't have it in their own neighborhood.
You want to add anything, Mariah? Look, I couldn't tell if you were about to say something.
Oh, no. The only thing on my mind was one example of this in terms of getting the vaccine to the immigrant community, and just like a mistake on the state's part, I think, was a lot of the mass vaccination sites in the suburbs were set up at the Illinois National Guard building. And when when that's the main mass vaccination site, I mean, how many immigrants are you going to get who feel comfortable going to a National Guard building to get vaccines? And so I think, you saw organizations who know those communities best step up. But that was just, to me, I mean, there are obviously reasons that made it the process more efficient, but it was an oversight. And I think that one thing that ICER did in response to that was set up a mass vaccination site, or a vaccination site at the Mexican consulate in Chicago. And that was just, I mean, the day it opened, they said it was just a huge celebratory day where people could come and feel safe to get their vaccine. So I think it's, also about these spaces that we set up and who we think about when we set those spaces up.
Thank you. We've got so many good questions. So if you notice, I'm trying to kind of look at the chat box and some other and trying to hone in on maybe a few different types of questions, because I know the teachers who are on this call today are of course interested in the content of your reporting, but I think also maybe we have some questions on the nature of reporting itself to a certain extent. And so maybe you want to try and transition to some of those a little bit. I guess this is from Joya, but I imagine I feel like this has been resonating through a few other questions, and it's going back to a certain extent about the role of community. And Joya asks, I'd love to know what tools you can suggest for students who are exploring or telling stories about their own communities. What questions should they ask themselves? So for both teachers and students, how to start thinking about reporting or telling stories about their own communities.
That's a really big question, really important question, but a big question. I'd say narrow the scope, right? What are you interested? What questions do you have? And then I guess take it from there. It's kind of hard to answer without knowing like what specific issue they're interested in, but I think kind of sitting down and thinking about the scope, the question you want to answer, what kind of information you want to gather, and who you need to talk to. Like, is there data? Are there numbers that you could use to see how big of an issue it is? Are there community leaders you can go to, or your neighbors, and ask, is this an issue? To find that human element. It's like a really large question, but I think it would be a really great lesson in class to have all the students come up with an issue they really care about and are passionate about, and then come up with a plan of how to tackle that and how to tell that story.
Similar to that, maybe more kind of, this is, I think, from Krishna, but directed more towards Mariah. You were talking about teaching patients to record themselves with their phones, or medical staff recording their daily work. And it made Krishna wonder, what are your reflections on the particular opportunities and challenges of reporting on the pandemic through an audio medium? How can we bring these lessons forward, especially with the growing popularity of podcasts and just these other podcasts in particular, but just different formats for reporting?
Yeah, thanks for the question. I would say my main advice is to remind yourself not to be too precious about audio, about gathering audio. Everyone has a cell phone. It's very easy to teach people how to use a cell phone to record their audio. Radio journalists and podcasters have hundreds dollar equipment, $500 recording device that records great sound, but a radio listener can't tell the difference between that sound and the sound on a cell phone. And so I think just not being too precious about it, and putting the device and the power in other people's hands. I recorded an essay that a 9-year-old wrote and taught her how to record on her cell phone. And she, recorded this essay and then told me afterwards that she was going to use like the voice memo app as a diary and continue to like talk to herself throughout the pandemic. And so I think it's just a gift that maybe has been like coveted by podcasters or audio journalists, but that we can just like give to everyone, and everyone should feel comfortable doing.
Maria, Kristen, did you want, the question was directed specifically to Mariah, but did you want to add anything?
Yeah, I would just say, I think that method was incredibly helpful. I never thought I would cover a pandemic as a longtime health reporter without stepping inside a hospital, but I did, because to me, it wasn't safe for me and my family. But there's a lot you can do with capturing people's experience by having them record themselves, by doing Zoom interviews. You can still see their space. It's not the same as being in the ICU with a medical team, but we did the best we could with the tools that we had, the policies we put in place as a newsroom, and the safety that we had in mind. But yeah, I loved the stories that Mariah captured. I remember that little girl talking, it is a really cool thing, and it is something that, right, I mean, we all have coveted in what we do, but I think that there are a lot of people who can share their experiences, whether it's with their iPhones or in some other way.
Great. I think related to this is another question in the chat right now, which is, how do you ensure that you are respectfully engaging with community and capturing those stories ethically?
I can answer that because I spend a lot of time thinking about this, like a lot. So I'm going to use an example from the work that I'm doing right now. And so I think that the best way to engage with communities of color is to be extremely transparent and to give them the power to say, I've had enough. I don't want to do this. I think it's important for them not to be surprised by the end result. I'm working with 2 women right now that are going to be part of my investigation, and I've been working with them for a really long time. And one of the things I am doing is that I'm actually sharing a lot of the records I'm getting from the city because it's their records. Like, the reason why I ended up getting them is because they gave me permission to get them, right? So last week, I got some records. I went and I talked to this woman, and I'm going through the records and I'm like, okay, this year is when it all started happening, and they charge you for this, and this happened, and this happened. And then she just kind of like stopped, and we had a really good conversation about the fact that she had been interviewed by another news outlet. And she was really surprised to see the things that they had included in that story, including a death certificate that she didn't know that they had access to, including a foreclosure that she did not know about, right? I've brought information to these folks. There's a lien on your property. Did you know about that? No. So then we talk about it, we have a conversation. So for me, it's making sure that they're participating in the reporting process, because I'm not going to use them as a prompt, as just a thing, like I'm using their story and I'm just extracting, right? Like, I just don't want to engage in that kind of journalism. I think that kind of journalism exists today, and I see it quite a bit. And so I think that if you do, like, again, it is not just focusing on the end result, the story that's going to get the awards. I don't care about this stuff anymore. I care about, how did I do this work? Was I fair to them? Was I, was the process equitable for them as well? Because a lot of times we have to own up to the fact that we have a lot of privilege in what we do. We get to decide what quotes make it to air. We get to decide what part of the story makes it to air. So I think it is just really important to be in community with those folks and really have those conversations. Not that they're going to influence the outcome of the story, but I do think that it is important for them not to be surprised, to say, oh my God, how did you get access to that? Oh my God, I didn't know that that was going on. And that makes them feel used. And that's the thing that I keep hearing over and over again. When I spend time in Englewood, when I spend time in Little Village, they know when you're not genuine. They know when you're just there to get people crying so that your story is moving, right? They know. And so I think that I'm just a big advocate of like changing the dynamics in which we gather information. And this gets, for teachers, this really gets at the heart of like storytelling. Storytelling has existed in our communities forever, and we do this thing. And so I think that reporting is a part of storytelling, but it's just important for us to not engage in these like extraction. Like, I want your pain. I want your pain so that I can produce this compelling story, and that I can win the awards and I can do the thing. And so I think that we just need to be more cognizant of the power imbalance that we bring in when we go into these communities. So, this is the thing, this is what I think about all the time. So I could go on and talk about this forever. So I'll just stop there.
Yeah.
That was really great. Go ahead, Kristen. Sorry, I don't want to interrupt you.
No, it's fine. yes to all of that. You definitely can tell, and you can even tell when you're interviewing people that they think you're not genuine about something. Yeah, I will say I feel like the longer I've been a reporter, the more and more I just want time. I just want time to spend with people to build that trust. I can't tell you how many times this happened to me. Just yesterday, I was interviewing someone for an hour on a park bench, and it wasn't until we were walking away and just walking back to where he lived that he said something that I was like, that was a key detail that I think, you know, it happens because it takes time to build trust with people. I mean, of course, we all cover breaking news. We cover things that happen in the moment, but I think it's important to always step back. And if you have the time, spend time with people, because it might take them a few months to open up to you, to really so you understand the true story. It's not just what 5 people told you that day and then you report it. It's a hard balance because we all have to do both. But yes, like to everything Maria said, I think it is really important that you're capturing the experience of the people you're covering in the neighborhood they live in, so that it isn't just a token story. It's not just something that you're doing, and you know, yeah.
Well, we're starting to run close to the end of time. I do think I have perhaps one question that is, again, going to be another potentially big question, but might be a good, also an opportunity for any last thoughts that the 3 of you have. And this is from Myra. And she says, do you have any advice for us on helping to keep our activism alive when the country is opening back up? Your coverage has been so important in showing how the pandemic exposes so many inequities in this country. Uh-oh, Myra just got rid of her question on my document. Sorry. There we go. Back now. The pandemic has given many people space and time to finally feel our anger and act for social causes, but I feel like we risk complacency as we return to normal. How can we avoid going back to normal for the worse? Again, perhaps a big question, but
yeah, so, you know, we're journalists, so we can't really advocate for any political action or organizing. But what I will say is that we've had a lot of time to think about our country. We've had a lot of time to reckon with our past. And I think that it is important for us to be really intentional about the ways in which we say we live our values, meaning at some point we are a collection of actions, like things that we have done, right? And if that series of things that you're doing in your life do not align with what you say your values are, I would say that's the time that you got to shake things up, right? Because at some point it has to be more than I am reading the books, I believe in this, I do this. At some point, it is what you do and how you interact with people. It is how you show up for other people. It is the ways in which you use your privilege to help other people, right? And so that's what I would say, is that you really have to engage with people, and you really have to say, you know, this is what my values are and this is what I'm doing. Are they matching? And if they're not, you got some work to do. That's the only thing I will say.
Yeah, I think that time is a beautiful healing thing, but it's also a demon because our memories fail us. We can forget things so easily. And I think that, you know, even just preparing for this presentation, reading some of the stories that we did 9 months ago, it's just incredible the amount of pain that people were in, that the stress I was feeling at that time, the despair that we just felt collectively, that is still, you know, it's still a tiny part of me, but it's not weighing on me in the same way that it was, you know, even 3 months ago, 5 months ago. And so I you know, I say go back and reread news stories or reread articles that resonated with you. Read your old journals, like I don't know if this is helpful, but it was helpful for me to reread stories and just like to continue to ground myself in what we have just gone through, as you know, now the world opens back up and there's so much to pay attention to, and there are things to cover. You know, I have to go cover a city council meeting after this, and none of it's going to be about the pandemic or racial reckoning. And so I would just say, yeah, keep grounding yourself in whatever way you can. And if you do look at your values and your actions and they don't line up, I'm a big advocate of doing something for 30 days and forming habits that way. I mean, maybe that's a kitschy thing, but I really do like identifying something that I want to change and trying to do it for a month straight, with the intention of developing that as a habit, not just as I'm going to do this for 30 days. It's going to be great. And then I'm going to, go back to it, but trying to develop meaningful habits is something that I think is helpful.
Kristen, did you want to add any last thoughts, or are you?
No, I guess I would say, yes, as journalists, we can't advocate for specific things, but I think, we can tell stories and we can highlight issues, and that's what we do. And I think if people keep the conversation going and there are certain issues that just keep coming to the forefront, we're going to perhaps keep telling those stories, things that are really important. So I would say, don't let the conversation die. If it's really important to you, keep it up in your life, keep it up in what you want to do. Think about what happened this past year. And if you think that there are issues that are important, keep that conversation alive. And I think this conversation, I really appreciate the time that you all gave us to talk about this project, because I think it was really important. And it's not, yes, we are winding down that specific vaccine coverage, but it's not going to go away. This issue is not going to go away. COVID's going to be here. I don't know for how long, but a long time. And these issues are going to keep coming back, and then it's going to be something else. So I think it's just important to not forget the past, and to just keep that conversation alive.